for this conference, Delivering for Nutrition in South Asia, Equity and Inclusion. And this plenary is titled, Looking Ahead, How Can We Achieve Better Nutrition Outcomes Through Equitable and Inclusive Research Programs and Policies. To moderate this session, we have with us Dr. Ramesh Kant Adhikari, who has a MD in Pediatrics from All India Institute of Medical Sciences, New Delhi. He retired in 2012 from being a professor in Child Health Institute of Medicine after completing 33 years of service. He also served as campus chief of Maharajganj Medical Campus and finally as dean of the Institute of Medicine. Besides his academic activities, Dr. Adhikari was involved in the field of nutrition, research ethics, and medical education. He was engaged in the preparation of Nepal Multi-Sector Nutrition Plan 2013 and was a technical member of High-Level Food Security and Nutrition Steering Committee of National Planning Commission. His research interests and publications include role of zinc in childhood diarrhea, vitamin A and child survival, and child feeding practices. After his retirement from the IOM, he is engaged in honorary capacities at the Nepal Health Research Council, Nepal Medical Council, and National Immunization Advisory Committee. He is currently chair of the Ethical Review Board of Nepal Health Research Council. We welcome you, Dr. Adhikari. Please a big round of applause. I'll also quickly welcome all our panelists on stage, starting with Dr. Saika Siraj, who's a trained nutritionist and public health specialist with over 17 years of expertise in managing large-scale nutrition programs. Currently, she holds the position of Country Director at Nutrition International, Bangladesh. Welcome, Saika. Next, we have with us Dr. Swarnim Wagle. He's an elected member of Federal Parliament in Nepal. He chairs the Institute of Integrated Development Studies, IIDS, a South Asian policy think tank established in Kathmandu in 1979. Welcome, Dr. Wagle. Next, we have with us Dr. Nafisa Shah, who served as a member of the National Assembly of Pakistan from the Pakistan People's Party for 3 terms. As an MNA, she has become member of the Standing Committees for Finance, Economic Affairs and Privatization, Law and Justice, Information and Broadcasting. Dr. Shah has served as Secretary of the Women Parliamentary Caucus as an all-party group, which was instrumental in steering rights-based legislation, particularly on women's rights and activities, and actively worked on legislation to prevent gender-based violence. Welcome, Dr. Nafisa Shah. Our next panelist is Raj Kumar Gope, who's a postgraduate in rural management and a team lead at Ekjut Dasra Harvard Social Impact Leadership Fellow, member State Resource Group, Jharkhand, under National Health Mission and Leadership for Environment and Development Fellow. He's a PhD scholar with Indian Institute of Health Management Research, Jaipur. He has been engaged in designing and implementing community-based and led programs for addressing health and nutritional issues. Welcome, Dr. Gope. Our final panelist for this session is Deepika Chaudhary, who's a senior health, nutrition, and population specialist and is responsible for supporting World Bank nutrition-related operations and advisory and analytical work in India, Afghanistan, and Bangladesh. More recently, she has provided operational and technical support to Yemen's health and nutrition operations. She has over 20 years of experience in maternal and child nutrition health and in South Asia in technical and managerial capacities. Thank you, everyone, for joining us. Over to you, Dr. Adhikari. Wherever you
want. Thank you very much. I'm honored to be here and to be given this opportunity. We have already listened to the profile of our panelists. We're very fortunate to have them. We have policymakers, we have program designers, we have researchers, all experiences are on the dais today. Dr. Wagle, in addition to being so many things, is also a former Vice Chairman of National Planning Commission, which guided policies and programs in this country. So to start with, I'm just repeating what has been being discussed since yesterday, that unless everybody is getting the benefit, nobody is getting benefit. there is no overall development. So everybody must be included in whatever programs we carry out to improve the status. We talk about the improvements in prevalence of stunting and various nutrition-related indicators, but that improvement hides subnational averages which are far worse than when we start what we had started at. So I think it's very important that our programs are based on those interventions which have good evidence of covering everybody and being implemented effectively. Having a good program is not good enough. Its implementation is also good enough. All of us have that kind of experience that a program, when an intervention at the beginning increases inequity. Those who are well educated, powerful, and have access are the ones to have the access first. And their indicators suddenly go far ahead of others, and it creates inequity further. So I think in that challenging situation, the first question is, why is it important in our field of work to talk about equity and inclusiveness? I'll start with Dr. Wagle to respond to this question. Thank you.
Thank you, Dr. Adhikari. I assume many of these issues have been discussed, and this is a closing plenary. So at the risk of repeating some of the things that have already been covered, let me just focus a little bit on Nepal. So Nepal is, of course, the oldest nation state in South Asia, but we've been historically a very extractive and exclusionary state, right? So we're still working our way through making the state more inclusive, more representative, and taking care of our lagging regions. And since 2015, we've had this federal setup, and now we have the luxury of working with data that are disaggregated by provinces, by palikas, by municipal levels, and all that. So when I was at the NPC Planning Commission 5 years ago, we produced the first multidimensional poverty index, and what struck us was this vast heterogeneity in development outcomes. It was known, of course, but the beauty was in quantifying how vast the discrepancy was. So just in economic terms, there's a province 6 we used to call now Karnali, which contributes to 4% of national GDP, and this province, Bagmati, contributes to 40% of GDP, right? And so from 4 to 40 among the 7 states, that's a huge discrepancy. And along with that income number is all the health and nutritional outcomes. So the stunting the ratios ranged from about 1/3 to more than half by provinces. And if you look at HDI, for example, there are some districts in the Tarai, which we used to think were quite accessible. There's a national highway that's been running through some Tarai districts for the last 60, 70 years. Yet numbers there on the social indicators were poorer than some of the very rugged, remote Himalayan districts. So this discrepancy, without much justification, expresses the urgency of addressing issues of equity and inclusion. And Nepal, again, another number is to say that this is one of the poorest countries, well, the poorest country in South Asia after Afghanistan. So undernutrition, I think, of this scale is, as scholars have pointed out, a life sentence of underachievement, right? And a real national shame. And we all know through the works of Heckman and others that this lack of early care accumulates over time into irreversible cognitive deficiencies. So if we have this ambition of catching up, given the demographic pressures and other challenges, geopolitical, climate emergency, so we have a very limited window posed by our demographic favorability to catch up very fast, very rapid economic growth. Yet you are producing young folks who are cognitively deficient, who would be very hard to train and all that. So this is an immediate problem, a humanitarian silent crisis, but also an eventual economic problem. And my argument here is this intergenerational persistence of poverty and inequality in a country like Nepal. Again, historically, very extractive, very exclusionary, lies in improving the availability and quality of nourishment. So the answer to many of our silent emergencies, as well as long-term potentials, lies in how we tackle nourishment.
Thank you very much. Thank you.
Thank you. Thank you, sir. I just would like to completely agree with you and start from there, like nutrition being the driver of productivity and thus being the driver of economy, it has to be equitable and inclusive in all different ways. And what 10 years back we thought was equitable and inclusive, that definition is changing every day, and that is very important to understand, and that is how we should look at equity and inclusiveness in nutrition and development in the future years. At one time, if we take the example of Bangladesh, we thought that reaching the pregnant and lactating women, reaching the women in the community was the most important equitable and inclusive approach, and that was, I'm saying that was of course right. But now if we look at the shift of this rapid urbanization, and we look at how from malnutrition we have crossed over to overnutrition, that makes it a different definition of equity and inclusiveness. So of course it is extremely important to be equitable and inclusive in nutrition, but in that process we have to look at and reach out to the most emerging high-risk groups, as I mentioned, like urban population, male, not for only sensitizing them to be supportive of females, but also for their own nutrition and well-being. At the same time, shifting our policies and programs, which was mainly focused on reducing undernutrition, to also recognize and have specific interventions towards combating overnutrition, especially in urban areas. And then the definition of hard to reach, that also needs to be inclusive. So the rural hard to reach is a different definition of where there is an island or our area or a distance area where you cannot easily go, but the urban hard to reach, who are in the buildings, in the concrete walls, but still hard to reach because no one has a targeted program there, for them. So with that,
Thank you very much for bringing out new dimensions. What we mean by inclusive. Most of the time we are thinking only about the rural poor and things, or undernutrition itself, but there are other problems. Yes, Dr. Shah, please.
Yes. Thank you very much. First of all, I'm really honored to be here and among researchers. I'm a politician, so for me it's an intellectual. I'm a former academic in my previous life. And for me, this is like an intellectual retreat when I come here. And this is my third engagement with this nutrition conference. The question is how I engage with inclusiveness and inclusion and equity with respect to nutrition and development. But I'm a politician and a three-time lawmaker. And what informs my work, of course, is the Constitution of Pakistan. And the Constitution of Pakistan is a fairly strong document when it comes to equity. It has chapter after chapter, article after article. It talks about equality guarantees. It talks about principles of policy. It even talks about we talk about intersectionality now. It talks about deprivation, how to address deprivation through social justice. So having said that, my own work, my own political affiliation is also with a political party that actually rose to power with the slogan, three-word slogan. The first word was food. So in the 70s, my party rose to power with the slogan of food, shelter, clothing. So food was the first word. And most of the programs, the social safety nets, etc., have come when our party was in power. So politically, of course, I'm very committed to nutrition, and intimately day-to-day work of politics in my own constituency. I always have the odd food bags ready whenever there are, people who, my constituents who come to me so there is this intimate connection. I just want to open up this debate with this. I think that the term equity cannot be addressed without looking at inequalities and what engenders inequalities in our society. And inequalities are not non-static. They are not ahistorical. They can come up overnight. And I just want to give the example of Pakistan vis-a-vis nutrition, and then I will pass on the mic to the other speakers. Now, Pakistan, if you look at Pakistan, it's an agrarian economy, agricultural country. And if you look at our statistics, they're amazing with respect to agriculture. We're the 8th largest producer of wheat. We are the 10th largest producer of rice. We are one of the largest producers of milk. And we have a huge number of livestock. So you have my own district produces dates, and Pakistan is one of the largest producers of the date crop. So crop after crop after crop, we have good statistics. But if you look at the statistics of hunger in Pakistan, it is in the red. It is in the the danger zone. We are in the hunger index 102, which is like serious according to the categorization of world agencies. There's 55% anemia among adolescent girls, 40% stunting children, and so on and so forth. And why I gave the statistics, and I have 50 seconds before I finish, and why I say that the equity should be unpacked and inequality should be looked at closely is because whenever there are huge strategy papers by world agencies, and they talk about things, why is it that there's such a difference between what Pakistan produces and why it cannot feed its own population, despite the fact that we have enough? Are there issues of governance? Are there natural issues? Are there historical issues? Are there political issues? And something that they repeat time after time, of course, Pakistan is susceptible to disasters. We have economic volatility, we have political instability, and all these break down food systems. All these break down, the food security issues. And of course, final point is agriculture. Agriculture is no more about nutrition. Agriculture is about commodities, about trading, and so on. And of course, the final word is the conflict. Pakistan has been a conflict-ridden society. And of course, conflict, of course. So the inequalities are dynamic. And no matter how much we pump in resources and on the supply side and all these programs, one disaster, one election delayed, one political instability incident, and we are put back. And this is something that as researchers and as policymakers, we have to think about when we address equity and inclusion. Thank you.
Thank you, Daksha.
Thank you very much. At the outset, it's a privilege and honor to be here at this meeting, listening to all the deliberations and at the panel. I'm going to apply a little different lens to this question that has been asked by Dr. Adhikari. Our work in the area of nutrition and development is largely around 3 aspects, and that's what we've been talking about over the last 2 days. Research, policies, and programs. And we think that it is critical that the design of each of these research, programs, and policies is equitable and inclusive. So that is the lens that we have to look at when we take forward our work on nutrition and development. Research, I think we've all underscored, is crucial for identifying and understanding the barriers to prevent certain groups that we've all been discussing from accessing affordable, safe, and nutritious foods as well as services. It provides researchers, like many of you, and program planners who are present here, information to fine-tune solutions to overcome these constraints. And I think it's clear that without a full understanding of these barriers, sound program designs to promote equity and inclusion is not going to be possible because we'll not achieve the desired impact. Equally important, we think, are evidence-based policies that help lay the framework for sound implementation. And we need policies, again, that factor these important dimensions that we are speaking about to reach the very last mile. So while research provides us feasible solutions, the processes and policies provide conducive environment for mandates and resource allocation. Where does the real work happen? The real work lies in the program implementation that we've been discussing, particularly in terms of delivery of nutrition services and promoting appropriate behaviors, which is going to lead to improved outcomes. So therefore, equitable and inclusive service delivery will ensure that the poorest and the most disadvantaged that we are speaking about, both in remote, urban and rural contexts, receive the required services as well as the support. And this collectively will result in improved nutrition outcomes.
Thank you. And I will again say that it's really been an honor to speak here under the chair of Dr. Adhikari, Professor Adhikari, with whom I have met many times earlier, and it's a nice privilege to be here. 2-3 things I would highlight. It's a proven fact that national, regional, district level inequities do prevail, but there are pockets of deprivation even in well-performing places, well-performing districts, and how to recognize them is very important. Second, we talk about geographical inequities, where we work in some areas where distance is measured by time, not by kilometers or miles. So you have to travel maybe 1 hour to reach 1 kilometer or 2 kilometers. So how to reach out to them is important. And when we work in villages, it looks like homogeneous from outside, but there are disparities within the villages. So just forget about districts or states. Even villages, they are not monolithic. So people live in hamlets. There are affluent people in the villages, and many socioeconomic and other indicators of even village persons are better than others. So when we analyze our data on malnutrition, on wasting, underweight and stunting with main village and hamlets, we could find difference, and those who were residing in hamlets were really deprived. So in terms of Ekjut, the organization I belong, we work largely in predominantly tribal areas, and Dr. Purnima was talking about choices yesterday. So this is the choice we as an organization we have taken. We have a choice to select the geographies, the communities we can work, and we have deliberately chosen the predominantly tribal areas, and we have based ourselves in one small hilly district of Jharkhand, and from where our work, all our work started. And we designed or we co-create one model called participatory learning and action through our collaborative or partnering communities, which just not only talks about equity, rather covers many aspects. For example, materials and modules and meetings are designed in such a way that it attracts them. So there is a change in this is a paradigm shift kind of thing. So instead of they coming to us, the program should attract them, and most marginalized and poor, they should attend the meeting. So for that, a lot of work has gone. So meetings have designed a lot of pictorial things have been added, stories have been added, so that, and meeting times have been decided as per their convenience, not as per the facilitator's convenience. The language used in the meetings are the language of the communities we are working with. So these are very small things we have taken, and I'm really happy to say that 5 randomized control trials back to back we have done, and in all the trials results have been found to be equitable. And in 2015, WHO also recommended this approach globally in high mortality settings. So equity leaving behind no one has become a slogan. Now it's time that we include our approach, we prepare our approach in such a way that it's also becomes a reality. Thank you.
I can say there are very important areas that we have discussed. Right? Dr. Gopes talked about participatory learning cycles, respecting the community from where we are getting the data, talking not to them, not asking them, but asking them. Actually, I remember, I just take this time to share this experience. When we are designing the study for MIRA, one of our leaders said, how come we cannot go to the community just asking them? So finally we came to a conclusion that he was of the opinion that we must have an intervention already ready-made and we should go with that to the community. Then only it will be acceptable. And the anthropologist and sociologist who was guiding that study, she was adamant, no, it can't happen. You go and ask them first, but it's good for them. And then we agreed, the consensus was, okay, we'll just go and ask them and design the program depending on that. So I think you brought that point, and I'm very happy that you mentioned it. Thank you very much. Now the next question is your experience of considering equity and inclusiveness that had made it change the work.
I think in Nepal and much of the developing world, obviously this sector was neglected for two major reasons, right? First, science hadn't found its way into mainstream development policy. So that problem was much more stark in poorer countries like ours. The second was obviously, even when we got government actions going, this glaring presence of coordination failure. So this has been documented in many reports, global, regional, national. Agriculture was obsessed with yields and output and not so much with nourishment. This was actually, this distracted us from this obsessed focus on quantity. On health, there was this focus on disease of the day and vaccination of mother and child and nutrition, because it's slow and internal, was often neglected. And in education, the focus was on getting kids into school after age 5, but how much they learned. This is the new learning crisis that we refer to in education. So this problem of coordinating across sectors, when we know nutrition is a multifaceted, multi-pronged, that you need an integrated approach. So I'm very proud of the work that has been done through the MSNP, the Multi-Sector Nutrition Plan. Again, referring to my days at the NPC, I was honored to launch the second MSNP when I was Vice Chair of the Planning Commission. And this is what exactly we tried to do, bringing in 7 ministries of the government of Nepal, health, education, agriculture, livestock, water, and local development, and also Ministry of Women, coordinated by a secretariat at the National Planning Commission. So for whatever value it could add, I think that was a good start. And many programs then took their cue from this signal sent by the government, right? This organizational, institutional setup. So I haven't seen a rigorous evaluation, but I'm sure folks here are present. Programs like Suhara, that has been funded by USAID, try to take this integrated approach, right? Combining agriculture, health, WASH, education, and all that. So I think that's a very positive experience that we can cite in the case of Nepal.
So one example from Bangladesh would be, just before COVID, there was a research done, bottleneck analysis of the nutrition sensitive approaches. One of the things that came out is that the social safety net programs and its importance to make nutrition interventions inclusive and equitable, and that is a must. And the set of recommendation that came out of that analysis later on, now it is in the process of being incorporated in the National Social Security Strategy. strategy, I wouldn't say it has already started showing impact, but it has started showing a difference in designing the safety net programs, improving them to be more nutrition and gender responsive, sensitive, wherever it is possible. So this is one example, I would say, and how important is to inform the policy to be changed in a positive direction, to be more equitable and inclusive. Another example would be from a program that we are implementing with government on maternal and child nutrition to increase the uptake of antenatal care services and the demand creation for quality antenatal care services. Inclusion of mothers have always been a priority because antenatal checkup has to be with mothers, but inclusion of the fathers was what we are trying to do. And again, research comes as a very strong component through a formative research, a set of materials and tools being developed, which targeted, the importance of male members in the family to be accompanying the pregnant mother, and which was very helpful, and also including the child for whom we are actually spending so much of care in the antenatal time, and making a card which actually the fetus talks to the mother, saying that, now I am 4 months old and now I'm 8 months old, and this is the care you need, and please go and take the services, which made a huge difference. So it's also important to give voice to the one who is not speaking. It might be more powerful in that way. And one just small point to add is also, last 2 days we are seeing that how nutrition food is so much, in the commercial sector, so much of involvement. So in responsible involvement of private sector is also a key that needs to be, factored in the future, activities that we do. I just would state one example of zinc and oral rehydration solutions, which is also a government program in Bangladesh, which we are supporting. But we realized if we don't add the small vendors, the pharmacies, and the village doctors who are individually providing services and bring them into this design, it's not going to work. So of course we also have to look at the private sector and how responsibly they can be supportive of nutrition interventions.
Nafisa, please.
Thank you very much. Pakistan has a fairly structured food security system, and it's very similar to India. So the structure is given by the government monopoly to procure wheat. And so there are wheat stocks available. And so this is one thing that relatively makes us food secure. And every time, so like when we had the floods and the entire, a huge district upon district were sort of underwater, these food stocks were the ones that, helped with food security. So it's a fairly stable structure. The only issue that causes problems is sometimes the prices to incentivize the farmers are a bit too high, and then that leads to food inflation, and the cost of wheat goes up. The other related that provides a structure to food security is our system of subsidized food sales through utility stores. That has been happening through the 70s. So this sort of gives us some form of stability when we are in crisis. And the other two programs, again, that are from the angle of inclusion, are both gender-based. One is, in the morning, we had a session on cash transfer programs. So Pakistan's example there was missing. And I could add that we have the Benazir Income Support Program that is totally focused on women, and it treats them as the head of the household who get the income support. And these are around 9 million families, 9 million women. It keeps increasing. And now that is now supplemented by another side nutrition program for the same beneficiaries. And we also have a number of food fortification programs that are often donor supported, but also the government has its. So we have all these programs, and these are all very similar to the South Asian. We learn from each other. As a parliamentarian, I always speak into what India is doing, what Bangladesh is doing, and so there are a lot of resonances and similarities. And my only issue again is the vulnerabilities. And for a country like Pakistan, the issue of political stability. For the past 2 years, the inflation has been 40%. And you can all really tell me how much of income support program, how much of all these food fortifications will help when your poverty jumps up just by one measure of whatever it is that happens in the country. And these are that is why, for me, the inequalities that keep coming up through untoward incidences, through disasters, these are some things that as politicians we have to constantly grapple with, and these are the things that lead to unrest and so on. But I don't know how much this forum can think about these unforeseens that really completely turn around. You may be working for years on a project in a district. Like I feel I started in my district 25 years ago, and with just one flood, like 1,200 schools are gone. So you have to start from the beginning. So these are some of the challenges and all this.
Thank you. I want to share an experience and example on a very positive note. And this is from India. It's the government of India's flagship POSHAN Abhiyan, which was implemented and is also currently being implemented by the Ministry of Women and Child Development. And it has demonstrated that as per the design of the program, it has reached the vulnerable communities, particularly in targeting pregnant and lactating women and young children, and better nutrition outcomes have been achieved. A detailed presentation was also made by my colleague Dipali yesterday in the thematic session, and a lot of results were presented. Now, the World Bank was associated with the POSHAN Abhiyan, and that is why I also highlighted from 2012 to 2022. And in addition to providing support at the federal level, there were also 11 high burden priority states which were a part of the support. A multi-donor trust fund was constituted at the World Bank to provide high-quality technical assistance, which was sought by the government. Now, just a few results, and also to demonstrate the scale and the complexity that the Indian government was able to overcome in delivering services. 60.5 million pregnant and lactating women and children under 3 were reached with services. 76% of Anganwadi workers were undertaking the priority home visits for maternal and child nutrition counseling. As per a phone survey that was undertaken during March, April 2021, that was the peak of COVID, 67% of the pregnant women received a home visit from the Anganwadi worker in the past month. 74% of the children continue to receive growth monitoring services. We also found that some of the difficult to follow behaviors like consumption of iron, folic acid, minimum dietary diversity, timely initiation of complementary feeding was known and practiced by as high as 56 to 65% of women during the COVID pandemic. Exclusive breastfeeding, particularly in these priority states, was as high as 81%. We also found that as per the National Family Health Survey, the POSHAN Abhiyan appears, there are indications that it has appeared to lower stunting from 40.9% to about 37% in these high focus districts as compared to when we pooled the other non-priority districts. And I think the most important message that we want to communicate in terms of the success is since 1975, it was for the first time that this program experienced transformations. The first was the shift in the age group from the older children to the younger children to achieve nutrition impact. The second, I think you've been hearing about the mobile technology, which has gone to scale in India by the frontline workers. The third is a people's communication movement. It's called the Jan Andolan. It's for nutrition behavior change. And the third is prioritizing the right tasks for the frontline workers, like growth monitoring and priority home visits. All these processes have been mainstreamed by the Government of India in the program that is currently underway called the POSHAN 2. Thank you.
I will share 3-4 examples and based on the participatory learning and action approach I was talking earlier. So it's a community capacity building process in which women's group members invite non-group members, adolescent girls, mother-in-laws, even men and service providers to analyze, to discuss problems, to prioritize them and find solutions. So first trial was done in way back in 2005 to 8. Second was 2011 to 13. Then a large scale work was done from 2017 to 20 by state government using frontline workers, ASHAs, as the facilitators. So in first 2 trials where monthly participatory meetings were happening, and these meetings happen once in a month, and meetings are for around 1.5 to 2 hour maximum. So we also have learned from critics like whether are we treating women as soft targeting or not. So in this approach, we are taking women's time as per their convenience, and once in a month for 1.5 to 2 hours maximum. And the result was 30% reduction in newborn mortality rate. And when we analyze the data through equity lens, we define most marginalized as those who were coming to poorest 2 quintiles, as well as those who could not read. And the reduction was 71% of mortality amongst the most marginalized. When ASHAs replicated this work, it was 32% reduction in 2 years of time, as well as 61% reduction in newborn mortality amongst the most marginalized. So equity also is a design issue. What efforts we are taking to reach to the most marginalized is very important. While the program should be universal in nature, but efforts should be taken to reach out to those where problems really are present. And this can be addressed through design, and ASHAs are able to do this. And 40,000 ASHAs were doing these meetings through states resources from 2017 to 20 in Jharkhand, and it's been published. So this is one example. Second example I will give on the field from nutrition. So we included, when we worked on nutrition, we included also the creches for children below 3 years of age, 6 months to 3 years of age. Again, as a civil society organization, we don't have huge resources. So we placed our creches in the areas we thought would be most marginalized using secondary data. So we all can find data that which are the areas or villages or the blocks where literacy rate is minimum. Of course, we'll not get all the indicators. Those few proxy indicators we took, we placed our work there, and there was significant reduction in all stunting, wasting, and underweight, and impacts were significant. And we have published all these papers. First 2 papers in Lancet, then PLOS and BMJ. So point is, we can design programs which can be equitable. We'll have to reach out to the most marginalized. We'll have to include others. Like these are all women's group meetings happening in a monthly basis. But there are, in design itself, there are every 5 to 6 months there is a big community meeting where men's role really become crucial. And interesting fact is that in these meetings, women actually, direct men's to work for them.
Thank you,
So
thank you. We'll
their
come back to that. Very good examples, very nice, but there is so much experience, but we have limited time, so we'll come back to it. Thank you very much. Now, without wasting much time, we'll just ask the panelists to advise the future researchers, community workers, and policymakers about 3 or 4 actions they would like to see them engaged in as we are approaching end of Sustainable Development Goal 2030. So your thoughts on actions, but most important 3 or 4 actions that you would like in place. Thank you, Dr. Wall.
Let me highlight 3 that resonate with me. The first is obviously on data and research advice. In countries like Nepal, we have the CBS, now called the NSO, the National Statistics Office, which is tasked with collecting data on nutrition and related indicators, heavily reliant on donor funding, right? So we'd rather, if I had my way, I would, probably create an endowment fund so that these things can be sustained in perpetuity, and not be driven by donor cycles to collect, the NDHS, the mix, these are all funded by partners. They do a good job, but I'd rather make it, self reinforcing, independent, etc. But even in the quality of data that we collect, there's some gaps, the missing areas. Colleagues who work in this field, who are better experts than me, advise that food consumption surveys, for example, are very infrequent. I think we should do a better job in doing those surveys much more frequently in pockets of deprivation, and advising interventions. So something that came out recently was that maybe iodine content in Nepalese diet is excessive. So this comes out of findings like that course corrects previous intervention. So that's very important. The second striking thing, which I found very interesting, was one of the surveys asked the share of women who exclusively breastfeed, right? And the ratio is around 62%, and this is what we traditionally used. But it turned out that once you did similar kind of questioning through other means, non-invasive biochemical tests, etc., that ratio, the respondents were found to be giving answers that they knew the folks who were questioning wanted to hear, right? So this 62% is apparently way exaggerated. It's not that high. So this calls for new innovative approaches to also collecting data and questioning old established methods. The second set of areas I'd like to see improvement is on incentivizing collaboration. So in a federal setup like ours, maybe municipalities that do a very good job at micro interventions, coordinating all these diverse entities that I talked about earlier, should be rewarded, right? So this kind of reward and punishment, not punishment, but rewarding the good actors, good players would be something to encourage in a country like Nepal, experimenting, trying, struggling to find success stories in the ground, and this transition from a very centralized approach. But there were successes under a very centralized approach as well. So iodized salt is a great success story from Nepal. Vitamin A is another success story from Nepal. School meals, it's a mixed, but we haven't done a rigorous evaluation of that again. So I think, these, where successes exist, what are the lessons to be drawn for diversification as well as scaling up? And finally, I think we need to bring in new actors, new approaches and new actors. And this is where the private sector would come in. Traditionally, this is a government donor kind of a domain, but private sector needs to come in. And 2019, we tried to do something along those lines in Nepal, Balyo Nepal Nutrition Initiative. Again, I was proud to have chaired that in the initial years. Unfortunately, got disturbed by COVID and other mishaps. But the idea was to bring in the private sector, for the producers of food, this large-scale fortification of food items, and incentivizing that kind of activities, and also bringing in philanthropies. So Bill and Melinda Gates, quite active already, but other established philanthropies need to come in to this sector as well. Thank you. Thank you.
So from Bangladesh perspective, I would say that the importance of multi-sectoral approach to nutrition, That is there. We are putting it in the policies. We are putting it trying to put it in different designs. But the coordination that needs to be there, the way data needs to be captured of what really it is impacting, where should the resources go most, that research and depending on that, fine-tuning the policies to kind of address the emerging nutritional problems that we have. That is one thing I would like to mention, that if we really want to, we are approaching 2030 and the targets doesn't seem like we are achieving as well as we achieved MDG. SDG seems a little off track. So that, and then currently Nutrition International is also working with government to formulate a multi-sectoral nutrition strategy for urban population, which seems like a very important step to be taken. There is a lot of policy, mostly focusing on rural setups, but now that there's rapid urbanization, and by 2025 we feel like more than 50% of the population will be in different urban settings. I wouldn't say cities, but villages are also not the same villages that used to be. So there is adjustment needed. We need research to implementation research is needed. We need more data. There are also data gaps. We talk about a life cycle approach for nutrition, but when we look at data, it's more female-centric data, pregnant women, lactating women. There is barely enough data to say that adolescent boys don't have anemia, or there is no need to have a program for them. So that sort of a data is needed. And then we go up to children under 5 years, and then we forget about the one in between before they start, their adolescence. So there are a lot of data gaps that needs to be addressed and looked into. Micronutrient deficiency data are also changing rapidly. New deficiencies are coming. There is also a lot of talk in Bangladesh about some of the programs that has been running for many years. Are we at a level where we have achieved enough, and now that blanket approach needs to be dropped or not? So that also needs to be backed by data. And the third one that, and the last one I want to mention is that, the social safety net programs with all the global, political crises, COVID, that is already started showing impact in stunting rates and, undernutrition, different indicators in Bangladesh. We are seeing that. So the social safety net programs have to be smart. It cannot be like suddenly we increase a lot of resources, but it has to, we cannot be missing opportunities. We have to find out every platform that can be utilized to deliver nutrition interventions or information, maybe inclusion in a different target group who we need to reach to with nutritional information. So of course strengthening the social safety nets, of course with background research, and also maybe modification of policies and program designs wherever needed. Thank you.
Thank you. I have 3 or 4 suggestions for researchers, and one is, of course, as an anthropologist, we used to look at the idea of reflection theoretically. How do you reflect on what you do, like self-reflection? And for this forum, one of my recommendations is, how about we apply inclusion and diversity and equity within, academic forums such as this one. In the South Asian context, are all areas, societies, countries, ideas, are we representing them all here? Or is there a question mark on this, as in some, research areas dominating more than others, and so on? So I would, one reflective idea would be to look at such forums from the context of ED&I, equity, diversity, and inclusion within the academia and within such forums. The second idea is, of course, from the South Asian context, collective research, so collaborative and collective research, and that of course would give a lot of energy and ideas and cross-cultural support to the research. Paper after paper, when I was hearing, towards the end, a lot of recommendations were what implications has this research done for policy? And I'm afraid that this forum, apart from a few of us, there are very few policymakers here. So perhaps one interface in such a forum, maybe a plenary, or sort of meet and ask questions with the policymakers would, because I feel there's such a richness of data, research, ideas, resource pool here, and people like us who could really take it to the next level are not in the picture. So I think that one, and how that missing link would be done is one suggestion. The other thing is, for my own, I find that a lot of these studies are very empirical, very data-based, and this is all very good, but qualitative research and then interdisciplinary research, so bringing in like gender studies, anthropology, economy, governance, public policy into this whole thing would also perhaps add further dimensions to all your very impressive work.
Thank you. So the four that I have listed and want to take the opportunity to reiterate is we need to continue the focus on the first 1,000 days of life with support to the pregnant women and young children. It remains an unfinished agenda. So this is the first one. The second is intensify and expand the coverage of appropriate complementary feeding interventions. We've seen over the last 2 days that this is a lagging area and it requires intensive and extensive work. The third is increase the focus on adolescent girls, nutrition and health, and delay pregnancies to avert the intergenerational cycle of malnutrition and poverty, which is another area that has been emphasized by the audience. And the fourth, just to echo my fellow panelists, we need to streamline and strengthen, not just talk, but really solidify the multi-sectoral approach with active support from identified sectors who we know will be able to identify and implement specific actions to improve nutrition outcomes. Health and family welfare, we know, agriculture, rural development, skilling education, water and sanitation. And these can together address the underlying determinants of malnutrition.
Thank you. 3-4 things. First is I feel that we should continue engaging with communities, and investing in communities is very important in such a way that communities are just not mere recipient of messages. Rather, they are also partners in the intervention. So we should design something, taking their help and their part of the interventions. This is one I feel with alongside other panelists. Public health is all about proving the proven things again and again. So this is very important. So lot more evidence should be generated from different parts, and more research and studies should be conducted, so that we can knock the door of when policymakers again and again, and so that they start taking things. One interesting thing what I have learned by talking to many people and through our work is equity and posting are not friends. That the moment you talk about reaching out to the most marginalized or equitable intervention, costs are bound to be high. So the kind of calculations presented by governments or even donor agencies while designing programs is cost per benefit ratio kind of thing. So there is a time. It's time that we need to think beyond this, taking longer time perspective kind of thing. So to reaching out to the most marginalized, to create equitable outcomes, we need to invest. And time, we are late, but it's this can even now be done. And yeah, that's it from my side.
Thank you very much. We're almost at the end of the program. We are very good discussion because there is a wealth of experience here. All of us, the panelists, have done so much in their work-related experience that there is so much to share with us today. But we are limited by time. So according to this format, I have to ask this within 30 seconds, if you can say something which is missing and that needs to be strengthened. Dr. Wagle, please.
I don't think the issue of behavioral change came up, so let me just highlight that. How do we nudge families, children, young people to demand healthy food? And that, I think the role of unconventional approaches, right? It's not just enough producing serious research and policy documents and these dry numbers. How do you convert that into relatable messages? So maybe, use of celebrities, entertainment programs to really motivate rural folk or even the urban poor to get into these areas. Sometimes, it helps to have a policymaker who also happens to be a celebrity. Barack Obama comes to mind. 2014 in the State of the Union address in the US Congress, he spoke in length. People interested could download his speech. It's really remarkable. He talks about the science, credits Heckman and others to invest in early childhood, the first 1,000 days, right? So that kind of approach is very, very, very helpful. So getting celebrities, entertainers, popular folks to whom people listen to air the messages would be very important to nudge those behavioral reforms.
Yep. I think one thing that Deepika mentioned, but I just want to elaborate a little bit, is the adolescent. Not only girls, but also boys, and not only in schools, but also in the communities, like countries like ours. I think barely 1/3 of the adolescent girls actually complete secondary education. So to look at community-based approaches to reach them better, to focus on youth, make them inclusive in designing programs, make them part of the system, part of the activities that we do. Also to remember that a lot of these late adolescents are also in workforces. There are barely any program that actually address those who are already in workforces. So I think this is another area that is very important to cover if we really want to progress further with the nutrition indicators.
Thank you. I just want to add 2 more words to the debate on equity and inclusion. One of them is right, because I think right to food, it's a much more powerful politically charged idea. And the other word I want to add is empowerment, because if you add these 2 to equity and inclusion, you add you sort of power them more, and these 2 ideas must go alongside equity and inclusion.
I wanted to say that South Asia has progressed despite challenges and the difficult years that we've had. And as a collective of the various people that we are here, we can take the nutrition agenda to the next level.
Just one thing, data disaggregation is very important. The data, whatever shows masks a lot, so we'll have to see what kind of impact it's creating to the people who are most in need. Otherwise, we will reach SDGs, but poorest and marginalized will keep on suffering. Thank you.
Thank you. Thank you. A big round of applause to the panelists and the speakers. We had a wonderful 1-hour discussion, and we learned quite a lot. There is so much on my page of notes that I have made that I'll try to transcribe it and keep it for future. But few things I would like to highlight: that we talk about data. Dr. Wagle came up with a new idea that endowment, don't expect only the partners. We should create some fund. That is a very novel idea. I hadn't thought of it. And another thing that we discussed about policy, involve the policymakers from the very beginning. Don't Ask them when the cake is ready, but involve them in the process of making the cake also, so that why this recommendation has come, what is the source, how is it being done. Nafisa Shah very clearly mentioned that involve them from the very beginning, create forum. Then Dr. Wagner again came up with this idea of using celebrities to whom people listen to. I must share this experience that one of my nutrition workers, colleagues, shared this idea that these messages the government system passes on, the younger girls who are new mothers, they are looking at the Facebook, Instagram, and they're saying that, what are you talking about? This is what YouTube says. So how do we counteract that? How do we deal with that? And then this is a very important question of adolescent boys, focus on youth. In 1993, we had done a study in Rukum. Very interestingly, boys were more malnourished and anemic than the girls. Girls were staying home, eating the fruits. And these boys had to travel 1 hour up and down, and they were hungry all the time. They were malnourished, actually. Most of the time, we were thinking that girls are worse off, but there, boys were worse off. And so I think these are some of then this is very important, right to food, and then strengthening and streamlining and strengthening the already existing programs. And for that, Dr. Wagle had a very good idea to incentivize the local units to carry out certain activities. So we have a wonderful afternoon today, listening to all these experienced people, and we have wealth of information and guidance for future. I hope the organizers will take cognizance of that. And I once again thank all the panelists, members on the panel, and the organizers for giving us this opportunity and organizing this session. Thank you very much.
Thank you, Dr. Adhikari. Can we request the panel for a group photo? We will now move to the conference closing prize distribution. For that, I would like to call upon Neha Kumar, Senior Research Fellow, IFPRI, and Samuel Scott, Research Fellow, IFPRI.
All right. We are here to provide a summary of the past 2 days, which is a very difficult thing to do given how much rich information we've heard and how many presentations from so many different experiences have been given. So that's why Neha and I are still talking to each other, because this really came together just in the last minute as we have been processing all of the rich information. So this is a picture of the conference framework, and the goal here is in the center of the circle. that we achieve better nutrition for all, right? All people. We're trying to be equitable and inclusive. And I think in this conference, we did a pretty good job of being equitable and inclusive. We had so many presentations from so many different regions, from all kinds of people, senior, junior. So I'm very proud of our, how we organized the conference and that we gave an opportunity to present to so many young researchers. And as I've highlighted here, there was a lot of interest in this conference. We had over 1,200 people register for the conference. I think there were around 225 or so who came in person, and many more were online. To start out the 2 days, we had learning labs. And so Wayamba University of Sri Lanka, Dr. Renuka Silva hosted a learning lab on 24-hour dietary recalls. Helen Keller International did 2 learning labs, one on artificial intelligence and the other on evaluating nutrition programs. And then Valley Research Group and Food Systems for Nutrition Innovation Lab conducted a learning lab on qualitative data collection. And so these were, I think, very well received and well attended. Yesterday, we heard a fantastic keynote plenary from Bhavani Shankar at University of Sheffield. He really talked about the new high-level panel of experts report and emphasized the 4 I's in the context of equity for nutrition in South Asia. Those are intra-household, intergenerational, intersectional, and interterritorial. Now, what we'll try to do is boil each session down into a couple of points. So Neha can go first.
All right, so the first thematic session was about agricultural solutions for better nutrition, and they provided examples of home food production models, integrative agriculture, and women's greater participation in pulse value chains as a way of improving household diets. An interesting presentation in this session was on how membership in FPOs, farmer producer organizations, can not only lead to better diets and higher incomes, but also improvements in women's empowerment.
We also had a session on health system strengthening, and we had 6 very interesting presentations. What kind of stood out to me was that health systems are made up of people, and we need to focus on the people who are delivering the interventions and that they have the resources and the training and support that they need. But then we also need to focus on the people who are receiving the interventions, and not just the target beneficiaries, but everybody else around them, including men, including the families and the communities.
So the next session was around rethinking food environments, and these presentations focused on regulations, labeling, fiscal policies, solutions for making food environments healthier. A few also discussed the importance of the 5 wild foods. I would like to highlight a study which presented a supply chain innovation that linked wholesalers, distributors, and retailers, along with the BCC campaign that educated the consumers of better food choices. This not only led to improvements in diets, but also increased sales. So it's a sustainable and a scalable solution.
In the behavior change interventions for better diets session, we learned that behavior change is not easy. And you can't give too many messages when you're giving behavior change interventions. We also heard that behavior change is often most effective when it's combined with a transfer, such as an in-kind food transfer or a cash transfer. And I'd just like to highlight a presentation from Tanima Sharman, which was, I thought, a very innovative way of thinking about a cash plus BCC intervention, where not only did she give cash and behavior change, but if the behavior change led to a change in practices, if somebody bought healthy foods, they get cash back. And so I thought that was a very interesting approach. Yeah, so this was the plenary session on day one that we ended with, and we heard from Aman Sen and Kenda Cunningham about the Rich Suhara program that has been ongoing. We heard about Suhara's monitoring system and the theory of change. And then we also heard about a new Imana grant and some work where they use structural equation modeling to explore some of the direct and indirect pathways from the program exposure to multi-sectoral nutrition practices. And then we heard from myself and Sumanta Nupani about our work under the Transforming Agri-Food Systems in South Asia project. And here we used a plate to farm approach where we sort of described from consumption all the way to climate, what's going on in food systems and at different levels.
The next thematic session was on social protection and lessons for nutrition. And a common theme in these presentations were the positive impacts of social protection programs on a range of nutrition outcomes. Another important thing that came out of these presentations was the importance of cash plus. So cash can only do so much. You need to have either a BCC component or something to make that cash more effective. And then one thing that I would like to highlight is that only one study looked at the cost effectiveness or the cost angle of social protection programs. We know these are programs that are funded by government, so it's really important to think about what are the cost implications for these programs as well.
Okay, and this session was on sort of drivers of food choice and understanding how people make dietary decisions. And the big thing I think that hit me was that nutritious foods are not always affordable. And so we heard a couple of presentations from Sri Lanka saying that half of the population in Sri Lanka cannot even afford a nutritious diet. We also heard a presentation from Bangladesh on minimum wage workers, showing that most minimum wage workers can't even afford a basic diet, that is a diet not even that includes meat or fish. So I think affordability of diets is something that we really need to think more about. Okay, and then the food systems and food security session was quite diverse. One thing that really came out here was that even when you look at people or households who are producing food, most of the food that they eat is not from their own production, it's purchased from markets and shops. And so given the rapid transition that we know is occurring in economies in South Asia and across food systems in South Asia, and Liz Ignowski referred to the time-space compression that's going on, we should really focus more on markets as this critical juncture and how people are interacting with markets and how that shapes their food choices.
The next session dealt with different social determinants like women's digital empowerment, influence of mothers-in-law on task burdens, influence of teenage marriage, alcohol consumption. But what resonated a lot with me was the success story of engaging men in improving nutrition behaviors. This is something that we've grappled a lot with in our work, and so I think this is something we really need to kind of look into and see what are some of these strategies that get men engaged. All right, and the session on where we live and what we eat dealt with a variety of topics ranging from heat and its impact on diets, spatial dynamics of double burden of malnutrition. But what resonated a lot with me was the study that tried to understand the why behind underperformance of a health and nutrition program. I think that is something that we really need to understand, the why behind a program not working, and try to address it in the next program that we design.
And the last thematic session was on identifying reducing inequities for better nutrition in women and children. Here we heard about different programs from India and Bangladesh, and how there must be plans in place to deal with crises before they happen. We also learned about the importance not just of this strong service delivery of programs, but also the financing of programs has to be in place. And one thing that really stood out to me was from Masoom Ali, from a presentation which emphasized that we have to really look beyond just diet diversity and think about the quantity of diverse foods that are being consumed. And
I'm standing here and looking at the room and it's almost packed. That says something about a closing session of a conference. And I would give that credit to the last plenary. I think it was excellent. I will not try to summarize it because I don't think I can do justice to it. So I will pick out a few quotations I wrote down in many, many pages of notes that I have, just like Mr. Adhikari. There was one quote of Mr. Wagley. He said, "Life sentence of underachievement when you have undernutrition in the country." Yes. What about the urban poor? You know, when we have programs targeting the poor in rural areas, what about the urban poor? And I think this thinking about including this in national strategies now to be ready for 20 years later when we'll have populations in urban areas living in poverty, thinking ahead. Political commitment is there, but it often cannot stand the test of conflicts and instability. So that's also important. Research, program, and policies, I think the design is the key. We need to have equity and inclusion built into each of these, and the design is what's important. Pockets of inequities in well-performing areas. Villages are not homogeneous. And then what resonated a lot with me was program designed for and by the people. Let's not make the people the consumers of these messages. Let's be empowered by making them, you know, the designers, so that they can actually learn from them and empower us as researchers. I have lots of other notes in my book. I'm going to stop here and probably turn it over to Dr. Sucheta Pyakur. I'm sorry, I'm not going to say it right. If it was in Devanagari, I would have been able to say it correctly. Pyakuryal, is that right? All right, from IADS. Oh, she's not here? Oh, okay. So Tim?
Thank you, Neha and Sam. I should first say I'm very humbled to have been asked to give a few closing remarks. In many ways, I don't feel that my degree of expertise in the subject area fully warrants it, but I do want to reflect as somebody who has got a background as an agronomist and as an agricultural scientist, what it has meant to me over the last few years of engaging much more intensively with a community of researchers and practitioners that focus on delivering for nutrition in South Asia. And I've been very switched on and excited by what I've seen in the conference. And as Neha indicated, the fact that we've got all of you still in your seats and it is past 5 p.m. is remarkable. And it's testament to the importance of this conference and of the subject that we were discussing and the strong dedication of everybody in this room. And from what I've seen in the conference and what I see is most unique from this work is that this conference is really about research from the region, for the region, by the region, and about the region. It is locally based, it is bottom up, it is driven in many ways by the most important issues and expert practitioners that come from South Asia and are dedicated to work across and in South Asia. And the thing that I've been most impressed with in many ways, and this might just indicate that I have realized that I am indeed now middle-aged, has the youth and the ways in which many of the researchers who presented their work in this conference, particularly in the poster sessions, were young, emerging, early career researchers who will become the next generation of leaders in these areas around delivering for nutrition, and not just in nutrition science and approaches, but really working across agri-food systems and looking at issues from farm production through markets to consumption and back again. And I think that is absolutely remarkable. In addition to that, we've had presentations that have come from a wide variety of angles and disciplines. The work has spanned quantitative and very sort of hardcore technical number crunching research, if you will, also including qualitative research from a variety of disciplines in humanities, in biophysical sciences, and in the socio-economic sciences, and so on. And that is very important for answering any complex question around how do we deliver better nutrition in South Asia, because no single discipline will be able to answer that question in and of itself. So where do we go from here? Well, I think we need to continue to build on the work that's been done here and foster bottom-up, locally relevant research that is stakeholder-driven and comes from the region. And as our colleagues in the last panel indicated, that means more than words. It means practice. It means doing that and delivering that on a daily basis, not only in the 2 days that we're lucky and privileged to convene here in Kathmandu for conferences such as this. And I was asked to indicate also to stay tuned, because our colleagues in POSHAN will soon be convening a follow-up dialogue on policy in India to also take the work from this conference and move it into action. I want to say just a few remarks also on things that I see emerging that were unique. And I also want to draw this to attention. Although he did not work in nutrition directly, I believe many of you are familiar with a strong leader that we've had in South Asia and in Bangladesh in particular, where I've been privileged to call home for 13 years now. But I was very saddened this week by the untimely passing of Dr. Salim Haq, who was a leader in climate change research and advocacy, not just for South Asia, but for lower income and least developed countries throughout the world, and also looking at the inequalities between work in climate change and policy, and always a strong advocate for work that favored the importance and gave voice to countries in South Asia and across the global South. So I was very excited to see that we had a number of presentations that started to focus on the nexus between climate change and climate adaptation and nutrition. And I was asking myself, is this more of the next frontier area that we need to see research and action move forward in South Asia and also more globally? We had very good presentations just today on water availability and how that interfaces with agricultural production and with nutrition. We had very good presentations on the intersections between pollination ecology and the production of nutritious crops. And these are, of course, interesting to me because my background is in agricultural ecology and as an agronomist. We had work on the effects of temperature and consumption patterns and on nutrition. But all of these issues also have strong socio-political dimensions that also need to be addressed. So I'd like to suggest, as we move forward to the next Delivering for Nutrition conference, to take that perhaps as homework and see a convening of researchers amongst teams that approach these issues dynamically, not only from biophysical standpoints or from strictly socioeconomic standpoints, but really convene around the nexus of climate change and nutrition, because this is likely to be amongst the largest issues that we confront as a community together going forward. I'd like to also say one thing to just be a little bit radical. And those of you who know me, I tend to sometimes get myself a little bit in trouble by maybe being a little bit overly radical. But I believe that the conference focus that we've put forward that strongly underscores the themes of equity, inclusivity, and social approaches to improving nutrition are very important. But I also want to call the kettle black. I want to refer directly to what the issue is at hand. And we're not talking only about the need to address equity and inclusion, but really what we're talking about is the need to address social justice in that work. And social justice incorporates and encompasses the ideas of inclusion and equity, but also points very strongly to the power imbalances that we have heard many of the researchers talk about during this conference, and how, if we want to see equity and inclusion in nutrition, we need to actually look at issues of justice and of power differentials and understanding who wins and who loses in development processes and developing approaches to overcome those hurdles together. And to use a word that may even become a little bit cliche because everyone's talking about it, but I do believe what this conference has actually been about, although not explicitly, is about decolonizing research and the need for rooting research in the region, and again, for the region, and again, by the region. So with that, I want to conclude, and I'd like to ask my co-conspirator, Purnima, to come up here also, because we should be going into a few slides that thank you all for your time here and for the work that's been done. I want to recognize that the D4N conference was put together by a huge team of people, many of whom are still in the room. And that includes all of the different organizations that you see listed here, and please forgive us if we've forgotten any of them. It includes a range of organizations in research and academia, strong presence and contribution from the CGIAR and from initiatives such as Transforming Agri-Food Systems in South Asia, as Sam recently spoke about. And I want to just ask, if you were involved in being one of the 40+ people that reviewed the 374 abstracts that were received, if you were one of the people that helped put on the conference, could you just raise your hand very briefly? Because we'd like to recognize and we'd like to thank you for your efforts. So without this team effort, none of this, of course, would have been possible. And I think that's remarkable. And I'd also like to, if I don't, can you get that back? Thank you. Take a moment. Well, I can start with the process as well. And as Purnima please comes up and assists us, I'd like to take a moment very directly to recognize both Neha and Sam. So Neha Kumar and Sam Scott, who are sitting right here. They've really worked quite tirelessly over the last months to put these efforts together, and they were the technical leads of the program to put this together. We'd also like to take just a very short moment to recognize the team that was the conference secretariat. And I'd like to request Purnima in particular to ask Aisha, who's doing exactly what she's been doing for a long time. She's not listening, instead trying to handle technical difficulties and helping us out. But Aisha, could you please come up here? Thank you. In addition to that, Julie Gosla, who's hiding in the corner, also supporting, does not escape a round of applause. And also sometimes very quiet but extremely dependable and hardworking is Fahim Mohammed, who we'd also like to have come up. And also, to conclude, very strong contributions also by Jyotsana Dua. So if you are around, I'm not seeing you, she's not here. Well, she also, in absentia, still deserves a round of applause. In addition to that, we've had very sort of silent and unseen, but crucial contributions from IIDS in Kathmandu and in Nepal, many of whom are here. If you're here, please raise your hand. So IIDS brought a huge team of people to bear who have actually been the backbone of it, making sure everything was set up, making sure that the conference was organized, making sure that everything happened appropriately and as it needed to. So thank you very much to our colleagues at IIDS. Last but not least, we need to recognize BRAC, IFPRI. Wayambia University in Sri Lanka, the World Bank, A4NH Academy, TAFSA, as we just mentioned. Also, CIMMIT and UNICEF were very kind to provide funds for supporting the wonderful audio-visual work that we have here, and also making sure that much of this was recorded, and I believe will also wind up online. So for those who missed the conference, they will be able to catch up and watch the sessions later on. Thank you, everybody, for your leadership.
We also would just like to recognize the financial contributions that many of the co-hosts made. This was extremely useful for many young researchers to attend the conference. I think we supported almost 46 young researchers, paid for their flight, their hotel, their per diem. So let's all give a round of applause. And now we'd just like to invite, yes, and I don't know what's happening to the slides, I'm not controlling it, but the AV team has been incredible. This is not easy, right? To do the video, to have all the rapid fire, the poster presentations, people online, it's been a lot to manage, so we really appreciate all of your support from Tech Trust. And now we would like to invite IIDS to give a couple closing remarks.
Thank you so much. I've heard that a lot of very profound discussion and points have already, been discussed here. But we've all, IIDS has been really moved and energized by what's going on, what has happened, what has taken place, what the conversations that have taken place in this hall. Thank you so much for partnering with IIDS. Thank you so much for involving us. Access to nutrition, especially in regards to equitable manner, in regards to making it equitable, making it inclusive, is something that is envisioned by IIDS as well. So us being part of this is very important for us. So thank you so much for involving IIDS. Thank you. Thanks.
And the last thing that we have to do is hand out some awards. So again, this was a very competitive, abstract-based conference, and we'd just like to recognize some of the highest scoring abstracts. So if you see your name here, please come up to the stage to receive a certificate and a round of applause. So we have Sajid Sufi, Priyanka Jayawardena, Hazrat Ali, Pallavi Rajkowa. We also have Anwesha Chatterjee, Ashwini Sopan Rao Jadhav, and Saira Parveen Jolly. Please come to the stage if you're here. And we also would like to recognize the fantastic poster presentations from Sweta Banerjee, Roji Suwal, Shalander Kumar, and Famida Akhtar. Please come up, come take a picture, get your certificate.
The big reveal. You want to do the big reveal? So we're thinking we'll see you in Sri Lanka next year. Yeah, we would like to thank the bursary providers that made this such a successful conference. And thanks to all of you who made it here and are still sitting in your seats. Thanks for the excellent discussions we've had, not only in the sessions, but outside in the coffee, at lunch, at dinner. I think this is a great community. It's my first time to be here in person, and I loved it. I hope the same is true for all of you. Thanks a lot.
Can all the volunteers please come up on the stage for a photograph? All the volunteers, all those wearing these red cards, please come up on the stage.